The major muscle of the anterior thigh compartment is the quadriceps muscle, which is four-headed. The primary function of these muscles is to extend the knee, such as during the gait cycle. Some of the muscles also cross the hip joint and assist with hip flexion. The anterior thigh is innervated by the femoral nerve, which originates from the dorsal divisions of the L2 through L4 nerve roots. This nerve enters Scarpus triangle, then courses beneath the inguinal ligament and lateral to the femoral artery. There's a groove between the iliacus and psoas through which it runs, and then more distally, it runs outside the femoral sheath. The nerve to the pectineus arises immediately above the inguinal ligament from the medial side of the femoral nerve, and then passes behind the femoral sheath to enter the anterior surface of the muscle. The anterior division of the femoral nerve innervates the Sartorius, while the posterior division innervates all the different quadriceps muscles. Important sensory branches include the anterior cutaneous nerves, as well as the saphenous nerve posteriorly. The first muscle we'll talk about is the Sartorius. The origin of this word comes from tailor, since sometimes tailors would sit in this cross-legged position and activate this muscle. The Sartorius is innervated by the femoral nerve and supplied by the femoral artery. Its origin is from the anterior superior iliac spine, and it inserts in the pes anserinus. Remember, this is called the goosefoot. You can check out our other videos on the medial and posterior thigh compartments where some of the other muscles insert here. The function of the Sartorius is to flex, abduct, and laterally rotate the thigh at the hip. It also assists with knee flexion. Clinically, surgeons use the Sartorius muscle as a helpful landmark to avoid the lateral cutaneous nerve of the thigh, which runs medial to it. Another clinical pearl is that during the Smith-Peterson anterior hip approach, the superficial internervous plane is located between the Sartorius and tensor fascia lata, located more laterally. The next muscle we'll talk about is the rectus femoris, which is the first muscle of the larger quadriceps muscle. In Latin, rectus means straight, and as you can see here, it is a very straight muscle. It's innervated by the femoral nerve, and it's supplied by the descending branch of the lateral femoral circumflex artery. The rectus femoris originates from the anterior inferior iliac spine, and it inserts at the patellar base via the quadriceps tendon, and indirectly to the tibial tuberosity via the patellar ligament. Its function is to extend the leg at the knee joint, as well as assist with hip flexion in conjunction with the iliopsoas. Clinically, the anterior-inferior iliac spine, where the rectus femoris originates from, can be avulsed. This is commonly seen in adolescence where the bone isn't as strong, and in settings such as quick starts like in soccer or track and field. The next muscle component of the quadriceps muscle is the vastus lateralis. It's innervated by the femoral nerve and supplied by the lateral circumflex femoral and profunda femoral perforators. This muscle originates from the greater trochanter and the lateral aspect of the linea aspera, and it inserts at the lateral retinaculum. Similar to before, it also inserts at the patellar base via the quadriceps tendon and indirectly to the tibial tuberosity via the patellar ligament. Its function is to extend the leg at the knee joint. Clinically, this muscle biomechanically balances the sliding trochanteric osteotomy against the pulling forces of the gluteus medius and minimus. We'll talk about these muscles in our hip video shortly. Also, this muscle can fill in the cavity from a girdle stone procedure. Next is the vastus medialis. It too is innervated and supplied by the femoral nerve and arteries respectively. The vastus medialis originates from the intertrochanteric line in medial linea aspera and also has a similar insertion as the muscles described earlier. Its primary function is to extend the leg at the knee joint. Clinically, if this muscle becomes weak, one can experience patellofemoral pain. The reason is because the pulling forces of the knee are not balanced appropriately, leading to patellar maltracking. The last muscle of this group is the vastus intermedius. Aside from its origin, the anterolateral femur, the vastus intermedius's innervation, arterial supply, insertion, and function are largely similar to the other quadriceps muscles. Alright, well that wraps it up. Looks like you're a pro at all the thigh compartment muscles now. Please click subscribe for more awesome anatomy videos.